Hi friends, welcome to the Emergency Medicine channel. Myself Dr. Ashik NB, doing post-graduation in Emergency Medicine. Today we are going to discuss about pharmacology of antiarrhythmic agents. So starting our lecture with the Vaughan-Williams classification of antiarrhythmics. Vaughan-Williams classification. He divided the antiarrhythmics into 4 different classes. So the class 1, that is sodium channel blockers. Sodium channel blockers. It is further divided into class 1A. Class 1A are moderate blockade of sodium channel, and the example is procainamide. Okay, class 1B. Class 1B is weak blockade of sodium channel, and the example is lidocaine. Class 1C is strong blockade. Examples are flecainide, and propafenone. Okay, that's about class 1. Class 2 antiarrhythmics are beta blockers. We will discuss in detail. Class 3 antiarrhythmics are potassium channel blockers. The examples include amiodarone, dronidarone, dofetilide, ibutilide, and sotalol. Okay, and the last class is class 4. They are calcium channel blockers. Examples are diltiazem and verapamil. So we will discuss each drug one by one. Okay. First about procainamide. Okay, it's a class 1A drug. Okay, indication. It is indicated for hemodynamically stable ventricular tachycardia. Okay, according to Procameo trial, it is more effective than amiodarone for hemodynamically stable ventricular tachycardia. Okay, the trial is Procameo trial. Okay, and the contraindications for procainamide are increased QT interval and also congestive heart failure, which is already discussed in our previous ACLS management of arrhythmias. Okay, and the recommended dosage of procainamide is the initial dose is 20 to 50 mg per minute infusion, and the maintenance dose for the maintenance 1 to 4 mg per minute. Okay, that is about procainamide. Moving on to lidocaine. Lidocaine is a class 1B drug. Okay, it is used in ventricular arrhythmias. Indication in ventricular arrhythmias. Okay, with a pulse, or in case of a pulseless VT or VF in cardiac arrest. Okay, and the dosage is different. The dosage is different. So the dose in case of a ventricular arrhythmia is loading dose 50 to 100 mg and maintenance dose 1 to 4 mg per minute, like procainamide. Okay, but in cardiac arrest, that is a pulseless VT or VF, the dose is initial dose is 1 to 1.5 mg per kg, and the further doses is just half of that, 0.5 to 0.75 mg per kg. Okay, so it is an alternative to amiodarone in case of cardiac arrest. Okay, that is about lidocaine. Moving on to class 1C drugs, propafenone. Propafenone, they are used for, they are again class 1C drug. Okay, used for preventing SVT, supraventricular tachycardia. It has got an additional beta blocking property present. Okay, and it is also used for the conversion of recent onset AF. Okay, for rhythm conversion of recent atrial fibrillation. The dosage is different for a weight below 70 kg and above 70 kg. So if the weight is less than 70 kg, the dose is 450 mg, okay, per oral. If the weight is more than 70 kg, the dose is 600 mg per oral. That's about propafenone. Moving on to flecainide. Okay, again class 1C drug used for SVT. Okay, SVT, also in rhythm conversion of recent AF. Okay, it has got additional property to reduce the excitability of, it will decrease the excitability of Purkinje fibers. Okay, Purkinje fibers, and also ventricular myocardium. The dosage is different for according to weight. Dose, if the weight is less than 7 kg, The dose is 200 mg per oral. If it is more than 70 kg, dose is 300 mg per oral. Okay, that's about class 1 drugs. Moving on to class 2 or beta blockers. Class 2 beta blockers are further divided into non-cardioselective, cardioselective, and with alpha blocking property. Okay, so the example for non-cardioselective beta blocker. Non-cardioselective. Okay, the example is propranolol. Okay, propranolol. It is used for indication. It is indicated for SVT, supraventricular arrhythmia, also ventricular tachycardia, also given in hypertension. Okay. Next is cardioselective. Cardioselective beta blockers are esmolol. Okay, esmolol, and it is indicated for hypertension, SVT, atrial fibrillation or flutter. Okay, it is an ultra short acting beta blocker. And second cardioselective is metoprolol. Okay, it is also indicated in hypertension, SVT, atrial fibrillation or flutter. And for the dose conversion, that is for converting from IV to oral dose of metoprolol, 5 mg IV, 5 mg IV is equal to 12.5 mg of peroral dose for metoprolol. Okay, and third one is alpha plus beta blocker. Okay, the examples are labetalol and carvedilol. Okay, as they are blocking alpha receptor also, it has got additional vasodilatory property. Okay, that is about beta blockers. Moving on to class 3 antiarrhythmics, that is potassium channel inhibitors. Class 3. So here we have the examples for class 3. First example is amiodarone, and the indications for amiodarone include in supraventricular arrhythmias. For supraventricular arrhythmia, it is used in case of AF, atrial flutter, etc. for both rate and rhythm conversion, and also it is used in pulseless VT or VF. Okay, then second one is dronidarone. Dronidarone is used in atrial fibrillation. Okay, not used in case of ventricular arrhythmias. Sotalol, used in atrial fibrillation or flutter, also used in monomorphic VT. Okay, dofetilide. Okay, it is used in atrial fibrillation or flutter, not used in ventricular arrhythmias. And ibutilide, again used for AFib or flutter. Okay. Then a few words of amiodarone. Amiodarone. Amiodarone possesses all properties of all four class of antiarrhythmics. Okay, it has got sodium channel blockade, beta blockade, potassium channel blockade, and calcium channel blockade property. Okay, so it has properties of all four classes. Okay, so about the dosage, the doses are different for different condition. So in case of cardiac arrest, for cardiac arrest, VT, pulseless VT or VF, the dose is, initial dose is 300 mg, initial dose is 300 mg, and further doses are 150 mg. But for in case of VT with pulse or AFib, atrial fibrillation or flutter, the dose is like 150 mg in 100 ml of D5 over 10 minutes, followed by 1 mg per minute infusion for 6 hours. Okay, and then followed by 0.5 mg per minute infusion for 18 hours, for next 18 hours. So that is the 24-hour dose of amiodarone. Moving on to the side effects of amiodarone. Side effects. Okay, it has got side effect from the CVS cardiovascular system. It will cause sinus bradycardia. Also, torsades de pointes due to QT prolongation. Torsades de pointes can cause AV nodal blockade, atrioventricular block, hypotension. In CNS, it causes paresthesia, can cause seizures or dizziness. It can cause dizziness. In GI, gastrointestinal system, it will cause nausea or vomiting. It can elevate liver enzymes. In the lungs, pulmonary system, cause pulmonary fibrosis, eosinophilia, interstitial pneumonia. Okay, and in thyroid gland can cause both hypo or hyperthyroidism, but hypo is more common is hypothyroid state. And in pregnancy it is contraindicated. Amiodarone is contraindicated. Okay, so that's about our class 3 antiarrhythmics. Moving on to class 4 or calcium channel blockers. The examples are, first one is diltiazem and the second one is verapamil. Okay, diltiazem and verapamil. Okay, And the mechanism of action of both mechanism of action include it will decrease or slows the AV nodal conduction. AV nodal conduction. Increase AV node refractory period. Decrease automaticity or excitability. Okay, and increase PR interval. These are the mechanism of action of diltiazem and verapamil. Okay, so indications. They are indicated in case of supraventricular tachycardia for SVT, and also in case of atrial fibrillation to decrease the ventricular rate. Okay, verapamil is used more commonly for aborting SVT. So this is verapamil. Verapamil is most commonly used than diltiazem, but for AFib, diltiazem is commonly used than verapamil. Okay, so about the dosage. The diltiazem dose is like 0.25 mg per kg IV. Okay, and it is followed by an infusion of 5 to 10 mg per hour. For verapamil, the dose is like 5 mg IV bolus, and if no response, you can give 10 mg IV bolus. Okay, and the contraindications for both drugs. The contraindications are sick sinus syndrome, cardiogenic shock, second or third degree heart block, and recent injection of IV beta blocker. Okay, and these agents are not given or also contraindicated for wide complex tachycardia. Not given for ventricular tachycardias. Okay, so that's about class 4. And there are some important other antiarrhythmic agents. So other antiarrhythmics. First one is adenosine. Okay, it is an endogenous nucleoside. Okay, it slows the conduction time. It decreases the conduction time in AV node. Okay, and it interrupts the re-entry pathways. Interrupt the re-entry pathways. That is the mechanism of action. Pathways. Okay, and it is a drug of choice for supraventricular tachycardia. Okay, the dosage and how to give adenosine are already discussed in case of management of tachyarrhythmias. Okay, the second drug is digoxin. digoxin. It is a cardiac glycoside. Cardiac glycoside. The mechanism of action is sodium, potassium, ATPase inhibitor. Okay, it is a positive ionotrope. Positive ionotrope. But a negative chronotrope. That is, it increases the contractility. Okay, increase contractility, but decrease heart rate. Also a negative dromotrope, that is decrease the velocity of conduction. Okay, decreases the velocity of conduction. Okay, so it is given in atrial fibrillation. Okay, and the dosage include 0.025 mg IV, and you can repeat a maximum of 1.5 mg over 24 hours. Okay, maximum dose is 1.5 mg IV over 24 hours. Okay, that's about the dosage of digoxin. Okay, and the last antiarrhythmic is magnesium sulfate. So mechanism of action is inhibiting calcium current. Okay, inhibiting calcium current. Okay, which causes early after depolarization. The calcium current causes early after depolarization, so which is inhibited by the magnesium sulfate, and it is indicated in the drug is given in Torsades de Pointes. Okay, and the dose for magnesium sulfate is 1 to 2 grams. Okay, IV in NS or 5% dextrose, given as bolus. Okay, that's all about the antiarrhythmic agents. Okay, and kindly consider subscription if you are interested in my videos. Okay, thank you.